Hi, welcome to our 11th Protect Our Province BC briefing. Our subject today is going to be on the topic of the transparency of government information during the course of the pandemic. I'll start by acknowledging that we are streaming from the unceded territories of the Coast Salish people. We're in different locations, and I'm personally on the Tsleil-Waututh, Musqueam, and Squamish Nations land. And I'll tell you a little bit about our organization as well. Protect Our Province BC is a grassroots organization of doctors, public health experts, and public health advocates that is working together to create briefings that are evidence-based information the public can then use to go forward and end this pandemic by using the best and most up-to-date available science on how the disease is spread and how to protect yourself and the people that you care about. We're deviating a little bit today from our standard format, and we're talking to two excellent journalists, Brishti Basu and Sean Holman. Brishti is a reporter with Victoria Daily, and Sean Holman is a professor of journalism at University of Victoria. And I'm Carrie Brown. Actually, I'm Carrie Coombs now. Used to be Carrie Brown. When I was Carrie Brown, I used to work in the Freedom of Information Department of a local government in the UK. My role was in privacy protection, but I worked side by side with the Freedom of Information Officer and our administrative team to process all of those requests and make sure that any personal information that was inside of those requests that was not releasable was redacted and the maximum amount of information could be published. So I had a little bit of expertise in this topic before we started, but I'll just jump right into it. Welcome, Brishti and Sean. Thank you so much for joining us today. Very happy to have you here. I'll jump right in with our first question for you is, as far back as December of 2020, BC was raising eyebrows for concealing COVID data. So Mario Posamai, who was the advisor to the Ontario SARS Commission in BC, said that BC's publicly disclosed data has been incomplete, inconsistent, and on occasion, seemingly contradictory. Dr. Henry later confirmed that the province had been concealing data after first denying it for fear that the data might be misinterpreted. I just want to start by talking a little bit about the necessity of transparency in government operations. Why do we need that? Why is it necessary, and what social harms can result if a government fails to respect the values of transparency and openness? I'll start with you, Sean, if you want to.
Yeah, absolutely. It's a huge issue, and it's actually a huge problem. And the reason it's a huge issue and huge problem is because of why we're supposed to value information in democracies. And we really value it for two reasons. The first is control. The idea is that with information, we can make better decisions about the world around us, thereby exerting control over public and private institutions. And with information, we can feel more certain about the world around us. We can better understand the past and present, and we can better predict the future. And when governments withhold information, especially information of this kind, people will look for other ways of getting control and certainty. And that's where we see the emergence of things like conspiracy theories and authoritarianism, which we're seeing actually in Canada with these trucker protests. That's really one of the foundations of it, is this lack of information, this lack of control, this lack of certainty. People have latched on to these conspiracy theories. People have latched on to some pretty destructive ideologies in their attempts to exert more control and certainty over a very uncertain and uncontrollable situation.
Right. On that subject, Brishti, as a pandemic reporter operating in this environment with especially with all of this going on in the background, have you noticed the tone of your interactions with the public changing? As someone who's out front doing pandemic reporting, I've seen a lot of harassment going on in my Twitter feed of journalists. Are you receiving some of that yourself?
Fortunately, no. I'm not reporting on the convoy protests specifically. I have a lot of empathy for the reporters who, are braving all of the harassment that they are in order to do that. Going back to the transparency part a little bit, I just wanted to add that, in the context of a global pandemic, what I've heard from researchers and experts from the get-go is that BC from the start has been one of the worst and slowest jurisdictions when it came to uploading data to the global database used by scientists to kind of figure out how the virus and its variants are behaving. So by not sharing that timely data, not just with the public, but also with scientists, you hinder their understanding of the pandemic globally too.
Right. Yeah. Yeah, of course. So then in terms of like, the government has often relied on the rationale that they have privacy concerns around releasing data. For example, around school outbreaks, they've cited privacy as a reason not to tell parents which schools are experiencing COVID outbreaks. As someone with a background in privacy regulation and policy and auditing compliance, I have always been bothered by that, because it's individuals that are entitled to privacy from government intrusion. It's not governments that are entitled to privacy from the public knowing what's happening in the world around them. Where would you draw that line between privacy and transparency? This is, I suppose, more of a Sean question, but who's entitled to privacy? Who's obliged to be transparent?
This is a fantastic question, because in Canada, privacy has often been used as a shield against accountability. In this country, we've seen time and time again governments across Canada thwart freedom of information requests, thwart journalists trying to get information from the government, thwart the public trying to get information from the government by saying, well, this kind of information violates someone's personal privacy. And the way we really want to think about privacy is to a certain extent the way you actually framed it. Privacy is about the government not being able to see what the governed are doing. That's privacy, right? The governed being able to not see what the government is doing, that's secrecy. These are two very different things. And, in a lot of ways, government has really appropriated privacy for its own ends. And that's pretty destructive, because we do need far more transparency in the society than we have right now if we're ever going to live up to the promise of democracy. And the promise of democracy is that we're all going to be making good decisions, rational and empathetic decisions, using the best possible information. And what's so troubling in BC is the NDP, which was the party that brought in British Columbia's freedom of information law, now seems to be doing whatever they can to erode that transparency. And I'm very troubled by that behavior.
Yeah, Brishti, do you have anything to add on that? Maybe from the perspective of professional standards in journalism. I know you can't just jump in and start doxing people left, right, and center based on vague accusations. Like, where in your profession is that line drawn?
Yeah, privacy, as Sean mentioned, it's important to maintain from an individual standpoint, but the practice of the BC government, specifically through the course of the pandemic, withholding information, is well documented. If you think back to, for example, May 2021, the Vancouver Sun had just leaked an internal document that showed BC was collecting neighborhood level case data. And this was at a time early in 2021 when the Alpha variant, or the UK variant, had just arrived in BC, and everyone wanted more granular data on where cases were happening. And at that point, the province, Dr. Henry, Minister Dix, everyone was saying they can't share any more specific data due to privacy concerns, and that they're already sharing all of the information that they collect. And after the Vancouver Sun leaked that internal report, the province said that this was the first time they had assembled this type of detailed info, and that they were going to make it public. So I filed an FOI request back in May 2021. It came back in like November 2021. But it found that basically these reports were actually being created on a weekly basis for internal use, dating back to at least March 4th, so 2 months before the leak. And that kind of tells us that the province did have more information that they weren't making public by citing privacy concerns. But after the report was leaked, they did commit to making that same information public on a regular basis. And as far as I'm aware, there haven't been privacy issues linked to neighborhood level data. So just one example.
Yeah, it's some fantastic work, by the way. And it really is troubling, right? Because it goes to, I think, what is sometimes the essential character of Canada, which is we can be a nation of gaslighters sometimes. We say we're one thing, but then we behave in a completely different way. And the most important thing often seems to be the way in which we're appearing as opposed to the way in which we're doing. And governments across the country, but particularly in British Columbia, which has attracted a lot of international kudos through Dr. Bonnie Henry in terms of its handling early on of the pandemic, is really guilty of that. We're not doing as well as we should be. We're certainly not doing as well as we should be when it comes to transparency. And yet we keep on proclaiming that we are in the middle of a pandemic where information is more important than ever before.
Yeah, it's interesting. It's an interesting thing to consider, where we're receiving accolades globally for basically for hiding information. And we've had independent scientists take a look at our death data, critical information that we all really need to know in terms of our personal risk assessment, and say that we may be undercounting by up to 78% how many actual COVID deaths. We have no idea who's being tested post-mortem to see whether or not COVID was a factor in their demise, whereas Quebec tests everyone who dies to see if COVID was a factor. So their projected deaths for COVID are like bang on to what the expectations would be given their excess deaths during the period, whereas BC's are very, very low.
Exactly. And that kind of gaslighting can really make people feel destabilized, right? Because what their lived experience is, what their reality is in BC, and this goes especially for journalists, but also members of the public, feels different than what the government keeps on saying, right? So it's part of the damage, the psychological damage that is being caused during a pandemic. And the government really needs to own that and do a better job of it. But it's interesting too, because the very reason why government is withholding this information is exactly the same reason why we want it: control and certainty. Because if the public doesn't have information, then it makes it easier for government to control how the public responds, theoretically, and it makes it easier for them to be more certain about how the public is going to respond to their decisions. So this control and certainty dynamic also plays out on the government side and on the secrecy side of the equation too. It's a mirror image of one another.
Right, yeah. On that same subject, a couple of weeks ago, February 8th, BC was awarded the Canadian Association of Journalists Award for Outstanding Achievement in the Field of Government Secrecy, the Code of Silence Award, which is not the kind of award you want to win if you're putting yourself forward as one of the most, just as transparent as any other jurisdiction. What would you say to that? How does BC compare to jurisdictions across Canada and around the world in terms of our access to information and government transparency in general? Oh, I'll start with you, Brishti.
So I think in recent months, sorry, I wasn't sure who was going first. But in recent months, I think response times have gotten better for both Ministry of Health and Island Health Communications. These are the two jurisdictions that I'm most talking to. I still make sure to give them a few days ahead of when I'm expecting to get a story out, which I know it's not possible for reporters who have daily news deadlines, but the quality of responses are still lacking. It's rare to get information that adds something new to a story or makes an issue clearer than it was. Oftentimes, they'll send me quotes from already publicly available sources like the BC CDC website. And as a reporter for an independent publication, it is next to impossible to get interviews. It took me weeks to even get the possibility of a 20-minute interview with Dr. Richard Stanwyck, who's the former CMHO for Island Health. But that being said, it's not impossible to get a straight answer on something that hasn't been shared elsewhere. For example, asking the Ministry of Health is how I found out that a positive COVID test will not be required for people with long COVID to be referred to post-COVID recovery clinics as of March 1st. Okay. This information, of course, should be shared more widely and made more publicly available, but it's something that was available by asking the Ministry of Health. At the same time, I have an FOI request about long COVID that I filed last summer, and it still hasn't been fulfilled, and I'm still waiting for it. So the FOI system, it's really not something that I rely on day to day for reporting, um, just because of the crazy, insanely long timelines. But government communications is also not something that I've learned recently to not rely on as well.
Well, and this is the challenge, right? Is because if you can't facilitate access to government officials without communications, and if you can't get freedom of information requests, then basically all that is left for journalists is to rely on the information the government voluntarily provides. In other words, propaganda. And that is not the basis for a democracy. That is not the basis for a democracy at all. And I really worry about where we are headed as a society, because if information ceases to have a controlling value, if information ceases to have value of certainty, right? And this is the world that we are increasingly in this post-truth age, you better believe people will look for other forms of certainty and control. And we're going to see xenophobia, we're going to see nativism, we're going to see nationalism, we're going to see autocracy like you wouldn't believe as a result of this exact dynamic that we're talking about today. And we have a very, very small gap of time to save evidence-based democracy. And it seems that many governments in Canada seem determined to head in the opposite direction, despite what this can mean for the future of our society.
Right. That is an interesting. That's an interesting thing to think about. Interesting and terrifying. I did notice, like my tenure as a person who worked in the Freedom of Information office of the council. Things have really changed since then. One of the things that we did was benchmark how are we doing compared to other jurisdictions around the G8 and and around the world that are, or Commonwealth countries. We all try to have sort of similar standards. And so we did notice a lot of backsliding, starting with Harper, just sort of disregarding the timelines. Whereas, here in our office, we're furiously keeping spreadsheets and benchmarks and milestones, making absolutely sure we're adhering to the regulatory timelines. And we had a centralized kind of group of people, even though as a small local government, that was like, we would harass the people that held this information until we got it. And make sure that it got out on time, and privacy timelines are the same. A lot of people don't realize that they have the right to view and correct any information held by any organization that is personal and identifiable information about them. So I processed all of those requests as well. And it was the same thing. The timelines were key. But then the government that I was working for did some amalgamation and restructuring and just actually did away with the whole department and said, from now on, the departments that hold the information are also going to be the departments that decide sort of whether or not to release it and what to release, without any kind of internal guidance on how to comply with the law or how to audit themselves to see if they're complying, and no, very little training or anything like that. And I wondered if that trend has been reflected kind of on a broader scale. So it's a bigger issue than BC. Is this something that's just been sort of backsliding over the course of the 21st century so far? That's the question I didn't warn you I was going to ask.
That's quite all right.
Sort of, my own perspective is historically, it seems like this has been going on for quite some time. But what I was curious about is, did things used to be better?
Things used to be different. So this whole entire idea of the importance of information really emerged from the post-war period. So this is sort of the period after the bombs were dropped on Hiroshima and Nagasaki, which ended the Second World War. And really, at that time, there was a lot of hand-wringing among the Allied powers as to what had caused these two major wars to occur in such close proximity to one another. Why had we sort of failed as a society, right, to have these two things happen? And the answer that was sort of arrived at by a lot of thinkers, including Franklin Delano Roosevelt, was that if only people had, and if only Germans specifically, had the true information about what the Nazis were doing and what the Nazis' plans were, and if they hadn't distorted that information in their own propaganda mills, then the German people would have never allowed it, and that Germany would have never went to war. So it was sort of interesting, like it was sort of this really fundamental faith, right? That if only people know, right, they'll make good decisions, right? And this idea of knowing equals action, right? Evidence equals action, paraded throughout the post-war period in some of the major social movements of our times. So as an example, the environmental movement was based around the idea of if only people know, then they'll care and act. The author of Silent Spring, founder of the modern environmental movement, her favorite quote was by the French philosopher Jean Rostand, which was, "The obligation to endure gives us the right to know." Consumer movement, Ralph Nader, this was also the whole entire idea of that movement was also based around the idea of information. If we know what products are good and what products are bad, if only we don't have to rely on advertising, then we'll be able to keep ourselves safe and we'll be able to make better decisions. And investigative journalism as well. That's the entire foundation for investigative journalism, which also started to really emerge, right, in the post-war period. So what we're seeing right now in this particular moment in time is a challenging of this fundamental assumption that our politics have been based on ever since the Second World War ended. And it has been eroding for a very long time, ever since basically the 80s, right? Which, you know, at the end of the 70s, this was sort of the nadir of sort of the freedom of information movement. And ever since then, it's really sort of been in decline. Sorry, that's a little bit of a historical, long-winded explanation of what's going on.
I'm actually really, really into that. I like to have a lot of context,
Totally.
and being a history nerd is one of the ways that I get that for myself. So that was a great educational moment for me. I'll just maybe shift the focus now. And for Brishti, do you find that like there are some critical pieces of information that are missing in order for you to be able to do your job to the best of your ability? Like, is the government citing their sources? For example, they make strong claims like, we know that children can't catch COVID, or we know that schools are safe. Have you had the opportunity or been given the opportunity to look at their sources, or even to know which experts they're listening to in order to come to these conclusions? And how much time, this is getting to be a long question, but you can answer any part of it or all of it. How much time would typically a journalist nowadays be spending actually reviewing the science themselves, as opposed to just taking the word of experts in interviews and trusting that they've done their homework?
Whew, that's a lot of parts to the question, Carrie.
Well,
I'll try to
broken it up.
Yeah.
Get you started, and now you can talk as long as you like.
Yeah, I'll try to kind of piece that together. But in terms of how often studies are cited, there have been times when our public health leaders do cite their studies, and there are times when they don't. A lot of the time, we'll get statistics quickly thrown at us at these press conferences with no real opportunity to ask for verification. So, for example, at a briefing last month, Dr. Henry said that long COVID cases in BC dropped by 50% after the Delta wave. And I couldn't find anything published to back this up, so I asked the Ministry of Health, and sure enough, they also didn't know where she got that statistic from. It's true that studies are constantly changing, and the science on the pandemic and virus is still developing. But I think if a public health official is using research or data to base their decisions, they should be able to cite that study, or at least, the ministry should be able to share the source of that research when they're asked for it. And then in terms of gaps in information, right from the get-go, one of the biggest missing pieces of information across BC was race-based data. We didn't then, and we still don't now, have access to how COVID-19 has differentially impacted people of color. And this is information that the province simply hasn't thought important enough to track. And so at various points in the pandemic, reporters have had to go in and look at whether cases correspond with more racialized low-income neighborhoods, and figure out that way that, yes, the virus is actually disproportionately impacting these populations. Other jurisdictions do have that data that makes this very clear, but in BC, we really have to dig for it and keep an eye on it. right now we still have confusion over basic things like how our public health leaders perceive the spread of the virus. Do they even believe in airborne transmission? Why the reluctance to stand by the science on N95 masks? Where is the added funding and urgency in messaging around long COVID? How many people self report positive on a rapid test every day? These are just basic questions that we still don't have answers for.
Yeah, and it's interesting too that the government's rationalization for refusing to collect or potentially refusing to share collected information on race-based data is equity, which is similarly confusing for me as a pretty active anti-racist, as using privacy to justify government secrecy. Like, it just seems like a conflation and confusion of these concepts that are, how can you achieve equity if you don't gather the data that you need in order to show the evidence that something is problematic and needs to be repaired.
Yeah, and speaking of which, the United States is so much better than us at all of this stuff. They've been collecting equity data for an extraordinarily long time, far longer than Canada has. They've been collecting better COVID data than Canada has. They've been and sharing it, and they've been collecting a whole range of data and sharing it better than Canada has for a very, very long time. And I think that's really something important to keep in mind, because we got freedom of information in this country primarily because we recognized that in the United States, they were doing this better than us. We felt bad about that. We felt bad that journalists and consumer activists in Canada actually had to go to the United States to get meat inspection reports about Canadian meat plants to know how filthy they are. That's one of the reasons we got freedom of information laws in the 70s and early 80s. And now we're sort of reversing that whole entire process and really going back to, I wouldn't even say going back, because to a certain extent, it's much worse now than it ever has been as a result of the control that we see enforced by public relations officers in government. We can't talk to ordinary civil servants anymore. That's something that used to happen on a fairly regular basis, and it just doesn't happen anymore. So the lines of information, right, our ability to access information, except propaganda, is really becoming constrained in this country.
Yeah, that's another thing that seems to have been going on for quite a while, starting with the muzzling of scientists, with the Canadian government deciding, like, look, we're not going to allow anybody who's employed by us to speak freely without first going through the Prime Minister's office. Does it seem, I keep adding these extra questions that I didn't warn you about, but it's so great to talk to both of you. But does it seem like any of that damage has been repaired, or have subsequent governments just decided to run with it? Like, that, that's how we do things now. We control what scientists can say to the public and public servants. It sounds kind of like that's the trend, that we're along the lines of, tightly controlled, centralized sources of information.
Yeah, 100%. I can actually talk to that, because I actually started off in government communications before I became a journalist. So I went from the dark side to the light side. So I was working in government communications in the late 90s and early 2000s. And over that period, I saw a real change that happened. So it went from, we would arrange interviews. We would sort of act as an intermediary for reporters, and we would arrange interviews between public servants who were not communications people and the news media. That's something that was sort of a routine part of my job. And over that sort of span of time, what we saw is sort of that role no longer was really in existence, right? Instead, we were the primary spokespeople. We were the people who were giving answers, right? And it wasn't the people who were the experts in government who actually knew the answers to these questions. And that has accelerated, right? So it's been within, I would say, this sort of, ever since sort of the public relations state sort of started to grow, and this really sort of happened again over the course of the post-war period, right? And then it sort of started to get, more stronger, right, towards the end of the 90s, right? That's been something that's been happening for a long time. But again, the United States is still so much better. I can phone up a civil servant down in the United States as a journalist, and I can get an answer to a question pretty much no problem, right? And that just doesn't happen in Canada. It's very infantilizing.
I've been in this industry for a lot less time than you, Sean, but that makes me nostalgic for the 90s, because now I'll get responses from, like, I'll request an interview of a communications person and get a quote in response, and it's like, this is not what I asked for.
Yep.
Just give me a timeline.
Oh, that must be
no, and it doesn't bear any resemblance, right, to the question that you ask.
Yeah, exactly.
That must be incredibly frustrating. That would be frustrating for me.
Well,
I've got
and
one more.
Well, in the PR industry, I was just going to say, like, the PR industry really needs to take some responsibility for this, right? I mean, this is a whole entire profession. This is a whole entire pedagogy, right? That is eroding democracy in some really fundamental ways. Because if we can only get propaganda, right, from the government, and from corporations, we don't live in a democracy at all. And it seems public relations practitioners are completely oblivious to this, or are complicit in it, one way or the other. And this is, I think, something that profession really needs to take a look at. They really need to take a look at how they are abusing, right, and how governments are abusing and how corporations are abusing this whole entire idea of message control to really erode some pretty fundamental democratic rights in our society. And it's been happening over time, and now we've gotten to the point where we're in crisis.
Right. Yes, and that does bring...
On a happy note.
Yes, disaster. That's what I get up in the morning for. This does sort of lead nicely into the last question that I had ready to go, and that is that, right from the very beginning of the pandemic, we've been just pounded with disinformation and the politicization of the science behind infectious disease control, and starting again with the Great Barrington Declaration, funded by the American Enterprise Institute, which is funded by the Koch family, or Koch family. I've never learned how to pronounce it. But so that politicization and misinformation has led to the types of outcomes that we're seeing now in Ottawa and across the country, with very disgruntled and extremely misinformed people rising up, and in some cases even taking arms, because they are so motivated by the false information that they've been exposed to, which is freely shared, whereas accurate information is hard to come by. How do we dig our way out of that? How do you see our way forward to repair the damage done to the trust in public institutions? After years of this, some of these people that are out there protesting probably have never lived in a time when you could freely access government information. There's a lot of young, frustrated, economically disenfranchised people being attracted to these movements that give them an outlet for their rage. So how do we turn this around? And let's see, I'll start with Brishti.
Honestly, I mean, that's kind of the question of the decade, or even the century. I don't have a full answer for that, but obviously what we've been talking about this whole time, transparency from governments, it would be the key to kind of starting to share that information that people so greatly need and desire. But at the same time, when you have misinformation so readily available, it's hard to kind of convince people to change their minds, even when you have the right information available. So I don't know, Sean, if you want to take this over. I don't really have an answer.
I do have a little bit of an answer to this question, because it's something that I've been working on and thinking about a lot. And the answer I'm going to provide isn't necessarily an answer that I want to provide, but I think it's a realistic answer, and I think we have to be realistic about these things. And the reason why I don't want to provide this answer is my whole entire career has been built around the evidence equals action formula, right? That's why I got into journalism, right? The idea that if only we tell people, if only that they know, right, then we can change things. And that's why the British playwright Tom Stoppard once wrote that, if your aim is to change the world, right, journalism is your most immediate short-term weapon. But that's all disappearing now. What I suspect is going to happen over the next 30 years, as climate change accelerates and political destabilization accelerates, I suspect that we are going to look for other forms of certainty and control. And I suspect the thing that we will look to is community for that certainty and control. So if that's the case, then, right, because community does provide certainty and control, it does. So if that's the case, then what all of us who are sort of concerned about evidence, believe evidence in the evidence and believe that's important, we should be in the business of forming new and more equitable communities around that idea, around the idea of evidence equals action, around the idea of more equity, around the idea of more resilience. I think we have to almost go back, right? We have to sort of start at the beginning again, because the alternative, right, is going to be so much worse. We can keep on fighting this evidence battle, but I think it's gone too far. I don't think it's a battle that we can necessarily win. And I worry about that, and I feel sad about that. But I think we need to think about that. And we need to sort of get in the business of forming evidence-based communities that will help us survive the coming 30 years of pretty radical climate change and destabilization that we're going to see all around the world. I know that's depressing. I know.
It is a bit, but it's also encouraging, because to a large extent, that is what this is. Like, we are all volunteers.
That is exactly it.
Motivated by, I'm motivated because I like to help people achieve things. And typically I'm just mashing the buttons in the background here. I built the website, I do some proofreading, but like, I leave it to the doctors to do all of the evidence related stuff, because I'm a folk singer and a documentary producer, like with a focus that's not, it's human stories more than, but yeah, this is what we're trying to do here. And I fully 100% agree with you that community is what attracts people to these more extremist sorts of views. And that's not new either. That's like, I read True Believer is a great book from the 70s, and a lot of that stuff still applies. And it's all about what attracts people in the context of that era. It was, cults and things.
Well, and that's a really interesting point, because I read a lot of stuff from the 70s, especially right now. And the reason I read a lot of stuff from the 70s right now is we are living in that moment again. Back in the 70s, you have to sort of project ourselves back in that time. We were living with the threat of nuclear weapons. We were living with the threat of pesticides. We were living with DDT and thalidomide. We were living at a time when the world was sort of waking up to the fact that we had this power of self-annihilation. And the world was becoming very uncertain and very uncontrollable, with stagflation and serial killers. Remember, this was the first time we saw that as a cultural phenomena as well. And we are back in that moment today, writ large. So I think there's actually a lot of stuff that we can look back to in the 70s and learn from. Some of the answers that they came up with, I think, don't apply, but some of the writing and some of the thought processes that were sort of going on back then are really, really helpful to look at. And we just, like, oftentimes we sort of forget history. We're not in an evidence equals action world anymore. We're not. But some of the thinking from that time is really, I think, helpful and vital right now.
Yeah, thanks. Brishti, anything to add before we move on to questions from out in the world?
Yeah, kind of changing the topic a little bit and going back to COVID and what we've been talking about with government transparency. I think a lot of what the rest of us are seeing now with COVID and how the province is handling information during the pandemic, people who've been advocating for throughout the course of the drug poisoning crisis have been dealing with this time and time again. And I think what you said about, when we don't have access to government, we don't have access to experts, we're left with just whatever the government is telling us. I think using the playbook from reporters who've been covering the drug poisoning crisis, basically by going to experts on the ground, to people with lived experience, that is something that has helped my reportage personally, and I know a lot of others who've had nurses, doctors, people on the front lines come out and speak about their experiences, often with the threat of professional consequences hanging over them. The fact that they have to be anonymous is still completely outrageous, but I'm glad that at least that's one avenue to get the truth out there for now.
That's an interesting aspect of this as well, because we do have lots of contact from health providers and people who work under the umbrella of public health that have been threatened and are afraid to speak out. They've lost jobs. They've had to relocate. Right now we've got one of our posts on the blog is a whole anonymous letter from a doctor from Vancouver Coastal Health, just outlining all of the ways in which our core principles of that organization are being violated by the public health response. And I just think like how stressful and devastating to people's mental health it must be to be in that environment where you're going into work, you're not allowed to wear the best kind of mask that we know science tells us and N95 provides the best protection because of equity, because the nurses can't have it, so the doctors can't have it either. Just these weird rationalizations for just maybe they don't want to admit they were wrong. I don't know. I mean, that's really broken my heart, and that's something that really motivates me to keep going with this group. Anyway, I will move on now to questions. We have a couple questions from the general public and a couple questions from the media. I'll start with the question we just received from Facebook. While we're sort of on this subject, as a citizen and a layperson, Heidi is always curious what us simple folk, I don't necessarily agree that the folk are so simple, can do to push back against government misinformation and propaganda. Brishti.
I would say just keep having conversations with your loved ones. Don't be listen if you have people in your lives who are vaccine hesitant or even anti-vax, don't be pushy with the evidence. Don't tell them exactly like here's where you're wrong, but listen to their concerns, see where they're coming from, and gently kind of insert yourself and your evidence into their thought process and try to have them start questioning the information that they're consuming. I think pushing back against the government is more difficult to do than it would be to kind of influence the people around you and your loved ones. So I would say that's a good place to start.
Great insight. That's so true. And Sean, anything to add?
Yeah, I think that's a really great recommendation because what we know is those personal connections are actually the things that really make a difference in a fact-resistant society. That personal connection to someone, being able to talk to them about your experience and your lived experience, really is the thing that makes a difference. But the other thing is that I would also just keep in mind in terms of your public political decision making, some of these things when election time comes and between elections, right? What is most important, right, in our society? And I think oftentimes we sort of get distracted with a lot of things. We sort of think in the short term, but there's some really major issues that I think are bubbling up in our society that are going to create quite a bit of problems that we're not really thinking as much about as we should. Things like climate change, things like public health, things like housing insecurity. These are all sort of long-term things that are sort of happening in the overall inequity of our society, right? We just need to sort of keep those things in mind in terms of how we operate as citizens, which we sometimes don't do a great job of. We have a tendency to get distracted.
I'll say.
Yes.
Yeah, I know that's definitely the case for me. A couple of questions from Nicholas Pescod. I hope I'm pronouncing his name right, from Czech News. let's see here. Island Health has stopped providing information about active cases in the region. Is that information still necessary and important for island residents? Brishti, what do you think?
I would say yes, but given kind of the breakdown of contact tracing overall, I can see how it's impossible for the province and Island Health to share that information and have it be accurate. At the same time, I think it would be a lot easier for them to maybe set up a system where they count self-reported positive cases through rapid tests. Um, yeah, I don't know why that hasn't been set up. I do think it's important to have an idea of where we are right now, and cases are a good way to do that. But right now, we're only relying on hospitalizations as like the main metric of where we are at in this pandemic. So, to answer that question, yes, I think it's important to know how many active cases we have on the island. Whether that's possible or not, that's the question.
Yeah.
Just to follow up on the subject of hospitalizations while we're on that, do we actually know yet our true hospitalization numbers? Because I know Penny Daflos has been fighting for that information for a while since it came to light that we were only counting people who are currently infectious. Mm-hmm. And once you're no longer infectious, you're no longer considered a COVID patient, even if you're intubated and in the hospital for weeks or months recovering. Are we up to date on that yet or no?
We're not. So again, great point. We don't have the exact count of how many people are in hospital with COVID. From what I hear from experts in the BC COVID modeling group, we also the data for hospitalization is also not shared in a timely manner. So a lot of the times, the information that's uploaded to the global database, for example, it's backdated or it's incorrect, and they go back in to make corrections. So it's difficult for experts to do modeling or other projections.
Anything to add to that, Sean?
Yeah, it is absolutely necessary for Island Health to keep on providing this information. And the reason why it's necessary is because they have that information. So people will wonder, what do they know? And the principle of transparency would say they need to provide that information to the public, which is funding the collection of that information, right? It's really just kind of as simple as that. And yeah, there might be asterisks next to that data as we sort of enter, a different universe when it comes to COVID and when it comes to COVID data collection, the prevalence of COVID. But that's information is still relevant. It's still important simply because the government does have it. And therefore we should know about it. I mean, this really isn't rocket science unless you want a father knows best, mother knows best government. Government should be sharing what it knows about a public health crisis with the public.
I definitely don't want that, and I fully agree. There's another question from Nicholas here. We did cover a little bit about race-based data, but maybe you both have something to add. Should we be releasing more race-based information? What are the benefits of doing this if we were to do it?
Absolutely, yes, we should be collecting race-based data. The benefits mainly are just acknowledging the fact that there is a problem, that people of color are disproportionately impacted by the virus. And then once you know that there's a problem, you're able to find a solution to it. Or people who are advocates can then create a plan for advocacy, But to first get there, you need to acknowledge that there's a problem, which is something that other jurisdictions have been able to do pretty seamlessly. So I don't see why BC doesn't do it.
Yeah, it's so well said. I mean, just because we don't know something doesn't mean the problem doesn't exist. And I know Canada sometimes likes to behave that way, but that's not really good democratic practice, and that's not really good public policy. So we should absolutely be collecting race-based information so we know the extent of the problem.
Right. On a similar subject, another question we've received is which province has been the most transparent during the pandemic? Do we have an answer for that? Do we know the answer for that? It's okay to say like we don't know. That's okay.
I would not presume to know the answer to that. No.
I will do a little bit of a dodge and say most places south of the border.
Right? Yeah. I refer to information from outside Canada routinely when I'm trying to figure out right from the very beginning what this is.
Well, I mean, a really good example of that was, there was a period where the Canadian military wasn't sort of really talking about, what its COVID infection rates were. And the reason why it said they weren't doing that was because of national security. And yet down in the United States, there was regular reporting of COVID-19 infection rates in the American military. So which country do you think has more of a national security concern, the United States or Canada? I think it's probably the United States. And yet they were being very public, right, with the extent of COVID in the military. And we still have really good data about COVID in the military down in the United States.
Right, yeah. I suppose I can add, internally in the background at POP BC, we have had a lot of conversations about the data from Quebec, which is not too bad. They're at the very least, they have a more or less accurate number of how many people have died. That puts all of the rest of the provinces to shame. And that's because the coroners over there are testing everyone, whereas we have no idea here who they're testing and why they're testing, what they're calling a COVID death, what they're not. And that is typical also in Alberta and many other provinces, but BC is the worst by far, according to Dr. Tara Moriarty, who we will be talking to in an upcoming briefing. A couple more questions here before we wrap it up here. I've got one that is unattributed. Trust in government plays a key factor in the pandemic response. How has the lack of transparency affected BC's pandemic response over the past 2 years?
I mean, the question kind of encompasses a lot of what we've been talking about already, but there have been just a lot of gaps in information that have led to doubts when it comes to the province's response, and more transparency would probably have led to a better rate of people being okay with the regulations and the measures being, announced or lifted. And then at the same time, the province hasn't always been able to back up the measures that they are taking with data that is publicly available or shareable. Yeah, that kind of is my answer, I think.
That's a good answer. Just gonna mention that just around in my neighborhood, like you can see people dropping their guard because they've been exposed for weeks and weeks to, at the start of Omicron, for example, the messaging, Omicron is mild. We don't really need to worry about that. Our vaccination rates are high. It's time to start, removing public health protections and just treating this as something mild. We know that that's the evidence tells us that is not the case. Omicron is not mild. And our data from the United States tells us that deaths from Omicron are significantly higher. The number that's bouncing around in my mind is 17%, but don't quote me on that. Ask one of the doctors. But and so then we have public health coming out and saying like, oh, I don't know why people aren't vaccinating their children. And in the briefings, I live tweet the briefings sometimes, and I've noticed there's this pattern of like, okay, we're gonna minimize the harm. We're going to hide the evidence, and then we're going to come out later and say, why aren't people more eager to get their children vaccinated? Like still, we're forcing every child under 5 is unvaccinated, and we don't know the long-term consequences on their health of that. But I sort of have felt like the whole way through, and I know that many of the doctors behind the scenes have been feeling like quite a lot of the information we're being given is purely to justify, the least possible interventions, which is also the least effective possible interventions. But that's what they want to do. They don't want to inconvenience anybody. They talk about how important it is for everybody to be normal and act like it's still, 2019. And that's obviously a huge priority for them. And business as usual has been a massive priority for them. Anyway, I've observed that. I know that some of the doctors in the background and advocates have been talking about that.
Mm-hmm.
And now it feels like we've arrived at what was the end goal the whole time. No protections almost for anyone. People are go out clubbing, they're dancing. We got more people in hospital than ever. Our hospitals are stretched. They're overwhelmed. More people sick than ever before. Suddenly after 2 years of trying to avoid this virus, I personally know like 5 people who have had COVID in the last couple of weeks. And we know that 10 to 30% of those people, depending on what metrics we're using to measure what long COVID is, are going to experience debilitating, serious long-term consequences. And their risk of dying over the course of the next year is significantly higher after having been infected. And I feel, and I know I'm not alone, because I ended up in a bubble of people that feel this way. What the strategy was, what we've ended up with is like, we've been trained to accept, overwhelmed hospitals, disability and death, sick children. And I every now and then I compare and I'm like, what if this was cholera? It would be like, oh, we just need to treat cholera as endemic. Like we know that you clean the air in order to protect people from COVID. We know you clean the water to protect people from cholera, but you don't hear any of these experts going around saying like, oh, let's just accept that cholera is a part of life. Anyway, that's how I feel about how the lack of information has impacted the pandemic response over the years. And we do have just one more question from Facebook before we wrap it up here. From Cindy Lee, does the privatization of various government services and departments contribute to the lack of a cohesive avenue to provide information and data to the public? I don't know, like the context for that from my perspective is that in the restructuring of the council where I was working in FOI, our entire information management got transferred to a private corporation. So now they're controlling the information that the government generates. And it created like an additional kind of barrier of like, oh, we got to call these people to release the blah, blah, blah. And I don't know, because that was close to the time that they got rid of our whole department, whether that's like a trend that's continued or whether it's caused access issues. Do either of you have insight into that?
I mean, whenever you take something out of government, right, and no longer subject it to freedom of information requests, it will contribute to a lack of information. But what I think has actually been the bigger challenge when it comes to lack of information in Canada is our move from prescriptive regulations to results-based regulations. What do I mean by that? I mean, at a certain point, we decided that we weren't going to start regulating things and we were only going to regulate the outcomes after the effect. So a good example is like, let's say the destruction of like a stream, right? That would be results-based regulation would be don't destroy the stream, right? A prescriptive regulation would be if you're working near a stream, do this, this, and this, and this, right? So what is sort of interesting about that is when you have a prescriptive regulation, then it forces the government to be more involved in society because it's constantly checking for these things. And that's one reason why data is actually still better in the United States, is because they still have a lot of prescriptive regulations. You can see this around mining and a lot of other sort of areas, right? Whereas in the Canada, we really sort of backed off from government involvement in society, which seems weird because of how we think about both Canada and the United States. But in backing off of our involvement in society, that meant the government started to collect less and less data about society. And that's where we really see a lot of data deficits in Canada today. Government used to do so much more in Canada when it came to collecting data, and we just don't do that. We don't know what we don't know sometimes these days, and that's becoming an increasing problem, not just for reporters, not just for the public, but for government itself.
Right. Anything to add to that, Brishti, or anything just in general to add? We're about to wrap up our hour here. I just wonder if either of you have any closing remarks.
I think Sean's answer was great for that. No, I don't think I have anything more to add other than I hope this conversation hasn't been too depressing and too cynical for the viewers. But Yeah, that's it. Thanks for listening, I guess.
Thank you so much for being here. And in terms of things being difficult and depressing for our audience, we don't really care about that. We are about what are the facts. And, the source of our hope and our optimism is that we're able to all gather together and talk about what the facts are and share them with people, and hope that we can connect with one another and support one another as we try to move towards, a better, freer, more transparent society, building those communities that Sean has talked about, so that we have some sort of like community grassroots level defense against these trends in government secrecy and disinformation. I just want to say thank you so much, both of you, for being here. That's been an incredible discussion. I've really enjoyed talking to you both, and I'll allow you to both go on with your day. Thanks so much.
Thanks.
Ooh, sorry, I cut off Brishti. I just wrap up our briefing today with invitation to join us again on Thursday. This week, we're doing something a little different. We got 2 briefings, this one and another one to respond to last week's lifting of protective measures. So on Thursday at noon, we'll be talking to world-renowned international aerosol experts, Kimberly Prather and Jose Luis Jimenez, about aerosol mitigations. We're going to review the outbreak at the Blue Grotto Bar in the interior last October. And we're hoping that out of that conversation, we'll have some solid recommendations for individuals and businesses on how you can protect yourself and your loved ones and the people who are participating in your organizations from the spread of COVID, given that the government seems to be stepping off the gas in terms of public health protections. So join us then, and until then, thank you very much for joining us today, and we'll see you soon.